This is who we are, a significant size company. We're fortunate to have Dr. Nash serve on our board. He's brought a whole new level of insight into the whole population health and wellness, which is going to be at the core of what I'm going to talk about today in terms of the answer for our healthcare problem. We'll touch on health reform. I don't generally use this terminology. The president called it health insurance reform, so I tend to use his language. And I think that's in fact what we ended up with. We'll talk a little bit about what comes next, and since then we'll talk about how we go about, in our opinion, fixing this, and then we'll conclude pretty quickly. But I'm not going to spend a lot of time on health reform because you all have read about it, you know all about it. I really want to talk about some of the unseen consequences that are going to emerge over the coming years here, which have significant implications to the system more broadly. One of the things to be careful about when you hear talk in Washington around health insurance reform or health care reform is that especially when they start throwing around the economics of it, the context of those conversations is a federal budget. It is not the system largely. And so the context for me today is the broad system, not just the federal budget implications of what was done. And you can see it's going to take a long time for this thing to play out. As a company, I can tell you we're going about implementing this thing as if nothing is going to change, and I think until we hear something different, that's the way we have to think about it. There's a lot in this bill that people are going to like as they learn more about it. There's a lot in this bill that people are really not going to like over time. What I will tell you is it does not address the underlying problem in this country, which is cost, real simple. Healthcare costs too much, and it's rising too fast, and it's been doing it for decades. And so we have made a lot of changes. Some good things have occurred here. We can argue about how it's paid for and all those things, but that's a debate for another time. What I will tell you is it hasn't solved the problem, and that's what I want to talk about today. Here's where the world is in terms of thinking about all this. I would take you down to the bullet second from the bottom in terms of the attitude toward the health bill itself. I don't think this really matters, frankly, politically, given the environment we're in. So even though the public is really uncertain about this, I don't think it changes much in terms of what happens over the next few years. The last bullet I'll guide you to is because this is a case of not really understanding how this system works and what the drivers are of it. If you ask the public, why are healthcare costs the way they are, they immediately go to health insurer profits. We are the evil empire. It's pretty easy to do. Happens all the time. 45% say it's higher cost. So it's about split. And higher cost is not the problem. It's what's driving higher cost that is the problem. So let me talk about hospitals, and I'm sure we have hospital people in the room today. And as a former hospital CEO, I want to tease out something here because it's going to show you how the chairs are moving around as a result of this. And then I'll come back to exactly what we're going to do about it. This is basically some California data around what's been happening with, in this particular case, growth in net inpatient revenue per day by payer category. So you see over the last 10 years, revenue per day has climbed 18% from the Medi-Cal business, and this is pretty good data. This is going to be true virtually everywhere you look if you move around the country, so there's nothing unique about California here. 76% growth in revenue per day in Medicare and 159% in the commercial private sector. So now let's go back to the bill for a second. If anybody tells you that by taking $150 billion out of payments to hospitals that we have made any ground up relative to the system, that would be wrong. Because that $150 billion in cuts, which your hospitals are going to suffer along with everybody else, is going to show up on the right side of this column, and it's going to be transferred over to the private sector. So we're moving the chairs around right here. Here's what's happened in terms of vaginal delivery. This is Oregon data. Vaginal delivery on the left, knee joint replacement on the right. I mean, costs are really screaming. Absolute growth of 69% and 44%. Here it is, cost per discharge. This is the cost shift. You can see it over a 10-year period across the bottom in the green bar. What's happened to inpatient revenue per discharge, not per day. So you can see the cost shift is occurring here. It's been going on forever. The estimate was for 2010 that the number was about $90 billion moving from the government side of the business to the private side. Where does that show up? It shows up in premiums and costs to individuals, companies. You know, when you go out to insure the people that work here, believe me, it's reflected in your prices, and I'm sure management knows that. So by this point in time, you think I'm probably blaming everybody for the problem. I'm not going to do that because I would argue there's no greed in all this. It just is what it is. Here's what's been going on here in terms of profit margins. This is, again, California because it's pretty good data from there. You can see the hospitals actually lose money on Medicare and Medi-Cal. They have a pretty good margin on commercial because they must. And then on the uninsured, they're really getting hammered. So this is the world that delivery systems actually live in every single day. And I will tell you that the bill made this worse, not better. Here's where the money's made in the health industry. The pharmaceutical industry does the best. Medical products and equipment are next. This is profit margins again. Pharmacy and other services, bringing it down. Medical facilities, this is the hospitals and others. And then insurance is on the right. So none of these margins would be considered egregious in any other industry in our economy. None of them. So it's not necessarily profits anywhere that are driving the outrageous costs we have. It is the underlying costs that are doing it. And this quote basically brings it all together. So this is what the chart looks like after reform on the expected cost per capita out to 2019. And if you can show me anywhere on this chart where it looks like anything has gotten better, I'd love to see it. Because I don't see it. So the problem hasn't changed. Now, what is the problem? Now we can start getting at it. It's the prevalence of chronic illness is a significant driver. This is the number of people that are suffering from chronic illnesses in this country. You can see the steady march upward. 25% of young adults have a chronic illness, 50% of middle-aged adults do, and 69% of the elderly have one or more. Our company does business with millions of seniors, and they have a lot of things going on in their health care. They do. People really don't understand health care very well. Health literacy is awful. Only 12% of adults have proficient health literacy, and 14% have below basic literacy. So they're chronically ill and have no health literacy. So what do you get? Higher cost, poorer outcomes. And remember, the problem is getting worse. Now I'll show you 3 slides that should scare you to death. This is 1990, obesity trends in the U.S., CDC data, and you can see everything is basically dark blue, which means only 10 to 14% of the people are considered obese by definition of having a BMI over 30. Now let's march ahead just 10 years. The new color, let's call it salmon, is greater than 20% of the population have a BMI over 30. Let's move 10 more years forward. We have an absolute disaster on our hands here. And you all are all medical folks. You know exactly where this is going. Diabetes is going to be the next big one, but there's all sorts of chronic illness associated with this. And so we can move the decks around on the Titanic as much as we want relative to the marketplace and all of the issues and the things we want to do to fix certain things about our so-called system. But if we don't address population health, and if we don't get ahead of this, and if we don't turn this particular trend line a different direction, we're toast. The interesting thing is the rest of the world looks like this as well. It may be worse here, and we may be ahead of others, but they're all headed down the same path. So I don't care what your system looks like. Even the nationalized systems, and we've worked with a couple of them over the years, the problem in a place like that is what? Aging population, chronic illness, and onset of obesity. The same exact thing. And the good news is, it is our fault. 50% of all costs are associated with our own behavior. We spent, see the little orange slice right there, that 10%? We just spent the last 2 years working on the 10% slice, basically access to care. And we could all agree that it was a good thing and needed to be done. But that's where we were working, that's where the energy was expended, and that's where this bill spends 10 years working, is on access to care. I would suggest that the 50% piece of this is where we're going to have to focus and where the real action is. And I can tell you, as a company doing what we do, we're building all of our efforts and focusing our energy on this 50% right here, because we think that's the right thing to do as well as good business. So since we broke it, we can certainly fix it, but it's going to require incredible behavior change. And we all know behavior change is very, very difficult. It has to be done one person at a time. If you ask people, we all know what we need to do to be healthy. This is not rocket science. Our physicians and others have been preaching this at us for decades. Eat less, exercise more, quit smoking, and read at a higher level. That's it. It's not hard. But the obvious answer, obviously, is the wrong one, because it isn't working. You saw what the charts say. Nobody's paying attention. Something's going on here. So clearly something else is needed, and that's where I want to take us today. In our opinion, we've been working at this for a long time, we think people have to be motivated to change behavior, and no one has found the formula for this yet, and I'm going to talk about some efforts to do just that. I think preaching and making people feel bad and shaming them is not effective, has not worked, so the sticks haven't worked very well. Instead, our argument is we're going to have to find a way to power people up, to get them motivated to do the right things because it's in their best interest and they want to do it. And this last little tagline may sound a little squishy, but we believe it. We need to find a way to make healthy things fun and fun things healthy. And then we have a shot at getting people to actually change their behavior and go in a different direction. Because healthcare is not a fun thing. As much as we are proud of what we do for people and to people and help them along, it's not a great process. And it's not convenient, it's not easy, it's not smooth, and they're not having any fun. So people are not going to want healthcare if they can avoid it. They're going to want to stay away from it if they can. And we need to find a way in their basic life and their behaviors around their interface with both the system as well as their own health to get them to a different place. It needs to be sustainable. I can tell you a lot of the research out there, and you all know this as well as I do, around weight loss and this sort of thing, says that these programs tend to work, but they're not sustainable. So we haven't yet found the right model there as well. It needs to be long-term positive behavior because this will not be fixed quickly. It's going to take a long time. It will lower cost over time. We'll get better health outcomes. And then our company is really building around this idea of lifelong well-being. We don't have a vision at Humana. It's actually a dream. And our dream is to help people achieve lifelong well-being. This is exactly how we think about it. It's a change. At the end of the day, we're an insurance company, sure. We do the things on the left. We do risk management. We do claims, all that stuff. It's not exciting. It tends to be financial services type of things. There's been early work in the wellness programs. Historically, not a lot of traction there, a lot of skepticism among employers. But I would take you to the right, and this is where the future is around how we're going to think about it and the things we're going to work on. The idea that individual consumers with some guidance can be powerful. So they're going to be put at the center of this. Not the hospitals, not the insurance companies, not the doctors. We have to put individuals at the center of this, in our opinion. We have to get to health risk avoidance. Not risk management, but health risk avoidance. Health analytics